Welcome, everyone. We are here for a friendly conversation in the context of the CLDF meeting in 2025. I am Dr. Alina Allen. I am a hepatologist from Mayo Clinic, Rochester, Minnesota, where I direct the Steatotic liver disease clinic. And I'm joined today by my friend and colleague, Sonal Kumar. Sonal, can you please introduce yourself?
Sure. Thank you all for listening to our podcast. My name is Sonal Kumar. I'm a hepatologist at Weill Cornell Medical College in New York, New York. Really happy to be here. And we're going to be speaking about non-invasive testing, how important it is to use non-invasive tests and sort of the future direction we anticipate for managing and risk stratifying our patients. Alina, we've been talking about non-invasive tests for so long now. There have been in algorithms for years, for primary care, for hepatology, for GI. Yet, we talked a little bit about this today, that we still end up seeing patients really late in the game when the focus is to identify those patients that are at highest risk for disease progression. Why do you think we're missing so many patients? Are people not using these non-invasive tests? Is it not, do they not believe in the reliability? What are your thoughts on that?
Yes, I agree. We seem to be talking about this topic a lot, and I do dream of a day where we say we nailed it. I think there are so many facets to this. It's such a prevalent disease. I think the sheer volume is one of the first main barriers. There are a lot of people, 1 in 3 adults. There are still gaps in awareness, one about the presence of this disease, and 2 about the impact of having excess fat in the liver, not only on the liver, but also on the systemic complications, which is another topic we really extensively covered today, from cardiovascular disease to impact on diabetes and cancers and death. There's still a lot more to spread the word, to educate people. And I think one of the biggest barriers, too, is that the non-invasive tests that we have are not as accurate that we can, if we compare to other diseases such as diabetes, we do not have a hemoglobin A1C for this disease. We have accessible markers such as FIB4 with several limitations. And we have elastography and newer blood tests that are not accessible to everyone. So I think we're making huge progress in how we try to create these pathways and spread the awareness. And there are already things that are happening that are good. Non-hepatology guidances and guidelines are starting to implement these, but we are long ways away to a systematic approach and case finding, really. So I'm hoping that it's not going to be a lot more years, but I think we are getting there. I think the other thing that I would be interested to hear your opinion on would be, as we clarify these guidelines, as we maybe improve the detection with different non-invasive tests, what can we do in the meantime? What can we do today to increase this awareness? And I think there's 2 aspects to it. One is the awareness of medical providers that can talk to the people about this disease, but also the general public, to go ask to be screened. What do you think?
Absolutely. I think, just to take the second part first, the direct-to-consumer approach is powerful. I see patients who they know their A1C, they know what their LDL is. And I think we need to, as providers, encourage patients to also sort of know the status of their liver, either know your FIB4 or know your ALD. We talked a lot about how we can empower patients to do that. And I think if patients are asking about it, that is going to sort of force the question with the providers that really should be screening, because if they, obviously come into a clinic and say, hey, how's my liver? You said I had, fatty liver, MASLD, do I have any fibrosis? Do I have advanced disease or cirrhosis? Does this mean I have cirrhosis? If there's a lot of disease awareness among the patients, then I think that can yield a lot of positive results as well. I think with providers who are sort of at the the top in terms of screening, primary care providers, endocrinologists. It's hard. We've talked about like the 20-minute visit and how much needs to go into that and how everyone is really spread thin. But it's an important part of disease management. And, it's not just liver disease. This is a whole metabolic disease. And I think we just need to educate more and more and more and push from the hepatology perspective of how important the liver is in that metabolic world, which historically hasn't. Now there's a lot more awareness. I mean, even at this conference, you can see how many endocrinologists are speaking, and we're on the expert panel discussions. It was really great. But 5 years ago, we didn't have that. So there is progress. And I think if we keep doing that and we keep pushing, putting, all of us together in the same room, cardiologists, primary care providers, there's going to be a lot more education, and it'll just become part of their practice.
Right. I think we are seeing a bit more readiness from that readiness aspect of accepting this as a true disease. And also from the population perspective, I think there is a bit more awareness now. Again, very little compared to where we need to be. But I think that from surveys that we've conducted, for example, people appreciate knowing about excess fat in the liver, understanding what that can mean to them, and actually learning that those numbers make them change their lifestyle. We recently completed this survey in the population. I was so surprised actually by how much knowing that number, whatever that number we decide it is, if it's ALT, if it's FIB4, if it's excess fat, how much of an impact it has on what they do in their lifestyle and how they change it. So I think as we accumulate these data, I do hope that we'll get to a stage where it'll be a health check of the liver, for example, into the primary screening, or at least in those with diabetes, if we were to start somewhere.
Absolutely. And I think we also have to recognize how much technology will play a role. Like, there's a lot of talk about implementing care pathways, and some institutions have already done this. And if you make it as simple as possible to incorporate NITs in care pathways, whether it helps decide what a patient needs based on their risk factors, do they need a FIB4, or it makes it easy to order the tests that are needed. I think that is also going to play a big role in, how when we implement these sort of across the board.
And decentralize a little bit from the burden we keep putting on primary care.
Absolutely right.
And maybe automate some pathways. I think these are future steps that hopefully we'll discuss in the next future CLDF meetings and other liver events.
Absolutely.
Well, with this, thank you for listening to this short discussion. I hope this was informative. It was a pleasure to spread the word about liver awareness and liver disease.
Thank you.